So just to give you a brief overview of what I'm going to be speaking about this morning, I'm going to start by giving a background to overweight and obesity and what we know about levels in Ireland. I'm going to go on then to speak about the literature review I conducted, which gives an international context of levels of awareness in other areas in terms of the cancer risk from overweight and obesity. I'm then going to speak through the results of the analysis of the Irish data, which gives us Irish awareness levels and determinants. And then I'm going to circle back to the literature review to just talk through some information that was gleaned from that about successful awareness campaigns elsewhere. So in terms of the background to overweight and obesity in Ireland, 56% of us at present are living with being either overweight or obese, and 20% of primary school children are living with being either overweight or obese. The highest prevalence, however, is in adults who are aged between 55 and 64. 39% of them are living with being overweight and 29% are living with obesity. And we know that there are some variations in terms of age group and socioeconomic factors there, and also there's a gender gap. But overall, these figures are quite stark. So what is the known association between overweight and obesity and cancer? So the underlying mechanism is quite complex, and I'm not going to go into that today, but we do know that 5% of all invasive cancer cases are due to overweight or obesity, and it is the second commonest preventable cause of cancer after smoking. So you can see on the slide here, there are 13 separate different cancer types directly associated with overweight or obesity, and it accounts for 300 cancer deaths per year. So before commencing my own analysis of the Irish data, I wanted to get a picture of what's known internationally in terms of awareness levels of the cancer risk from overweight and obesity. So to do this, I formed a research question using a COCO-POP framework. So the condition was knowledge of obesity as a cancer risk factor, and that was the dependent variable. The context were those socio-demographic and lifestyle factors, and the population were adults. So the initial search across 5 different databases yielded 254 studies. These went through title and abstract review and also then full text review. And that left me with 20 papers to include in the final literature review. So what was known from these papers in terms of levels of awareness of obesity as a cancer risk internationally? So again, as Cliona mentioned, I subdivided that into unprompted awareness and prompted awareness. So unprompted awareness, that's those people who recall spontaneously when they're asked about cancer risk. What do you know is a cancer risk factor? And if they spontaneously thought of overweight or obesity, they were considered to be unprompted aware. And only 25% of adults in the UK were found to be aware in a study conducted by Hooper, a paper reported by Hooper in 2017. A further paper in 2023 reported 17% of public in the UK were aware, and 24% of members of Parliament, which is important because they're the policymakers. There was only one small Irish study found, and that was conducted in 2015. And in that paper, 32% of Irish adults were aware, and only 41% of healthcare professionals. And then what of prompted awareness? So prompted awareness is those people who recognise obesity or overweight as a cancer risk factor when they're presented with a list of cancer risk factors and asked do they think these could potentially be linked to cancer. And that varied quite significantly across different countries. So just 35% were aware in Saudi Arabia, but up to 83% in Canada. In terms of the UK, that Hooper paper reported that when prompted with a list of cancer risk factors, 57% of adults in the UK picked out overweight or obesity as a cancer risk factor. But interestingly, there was actually no Irish figure available for prompted awareness. And what of the different socio-demographic factors that were assessed internationally across the literature? So you can see there's quite an assortment here, ranging even down to one that was used as a proxy for socioeconomic status, which was vehicle ownership in Malaysia. But not all of those factors were included in our own survey here in the National Survey of Cancer Awareness that was conducted by the NCCP. So I've highlighted those that were conducted here in the NCCP as well. And that brings me on to just summarising that national survey of cancer awareness and attitudes in terms of the background to it. And again, you've already heard some of this from Cliona, but I'll just recap for you. It was a cross-sectional survey. It was performed in 2022 and it included 2,874 adults. The responses were weighted to align with the population profile, and the survey covered 4 separate domains, including demographics, beliefs about cancer, cancer risk reduction, and awareness of cancer and lifestyle factors. But the 2 questions that interested me the most in terms of the national survey were question 4 and question 5, because they addressed both prompted and unprompted awareness. The first one, question 4, asked people about their unprompted awareness. They were asked, what things do you think could increase a person's chance of developing cancer? If they mentioned overweight or obesity, they were considered to be unprompted aware. That was recall. They were recalling that risk. Then in question 5, they were asked, for each of the following, can you tell me which, if any, of these you think increases a person's chance of developing cancer? And the last item on that list was being overweight. So that was asking them about testing their recognition of the cancer risk from overweight and obesity. If they picked that out from that list, they were considered to be prompted aware. In terms of how I analysed the data, the dependent variables that were selected were unprompted awareness and prompted and unprompted combined, which was considered recognition. And there were 12 different independent variables selected for analysis, which you can see here in the list. SPSS was used to conduct the data analysis, and descriptive statistics were performed, first of all, to just give a profile of the respondents to the survey. A multivariable logistic regression analysis was then performed both for unprompted or recall awareness and for prompted unprompted combined, which was recognition. And then odds ratios, adjusted odds ratios, and 95% confidence intervals were calculated and reported. So you've already seen some of these survey respondent profile results in Cleona's presentation, so I won't go through it all in detail again. But just to kind of briefly recap, we had an equal gender distribution. The majority of the population were aged less than 45. 63% of the population were working. 5% were unemployed or unable to work. And in terms of educational level, 8% of our respondents had left school after primary school level alone. 43% had gone on and completed secondary school education. 24% had gone to post-secondary courses, and 25% had gone on to tertiary level education. In terms of their ethnicity, 87% described themselves as white Irish, 8% as other white, and that group includes the Roma community and Irish travellers, and 5% described themselves as being of Black, Asian or mixed ethnicity. Our respondents were located around the country, 29% in Dublin, 27% outside of Dublin but still within Leinster, 27% in Munster, 10% in Connacht and 7% in Ulster. So we did have a geographic distribution. Just less than half of the respondents exercised less than 5 times per week, and just over half exercised 5 or more times per week. And in terms of daily fruit and vegetable intake, over half eat less than the 5 recommended portions daily. So what of our Irish awareness levels? So just 25% of the Irish population that we surveyed were aware that overweight or obesity is a risk factor for cancer, and that was unprompted. So 25% recalled it when they were asked to list risk factors for cancer. And 72% of the population recognised the risk when a list of cancer risk factors was given to them. So as you can see, these levels are extremely low, even in terms of the international context that I spoke of earlier. Only 1 in 4 Irish people think of overweight or obesity when they're asked to list cancer risk factors. So what determines whether or not these people recalled, or who was more likely to recall unprompted awareness? And there was a significant association found between unprompted awareness and people's level of education, where they lived, and whether or not they were achieving exercise guidelines. So you can see I've highlighted here some of the significant findings. So those who have attended secondary school education are 1.5 times as likely as someone who has attended primary level education only to recognise that cancer risk. Whereas those who have gone on to third level education are more than twice as likely to realise that overweight and obesity is a risk factor for cancer. Interestingly, those who lived in Leinster but outside of Dublin were 25% less likely to be aware of that cancer risk compared to those who lived in Dublin. And those who were exercising more than 5 times per week or meeting the exercise guidelines were 23% more likely to realise that overweight and obesity is a risk factor for cancer compared to those who were not meeting the exercise guidelines. And then in terms of recognition, so these are the people who were able to recognise that cancer was associated with overweight and obesity when they were presented with a list of risk factors. And I found that there was a significant association between this combined prompted and unprompted awareness, and again, level of education, their employment status, their ethnicity, and their fruit and vegetable intake. So in terms of the results of that, it was found that those who were in third level education were 1.5 times more likely to recognise the risk compared to those who had just completed primary level education. Interestingly, those who were students or those who were unemployed were half as likely to recognise the risk of overweight and obesity with cancer compared to those who were working. And in terms of ethnicity, those who described themselves as other white, that group that encompassed the Roma community and Irish travellers, and those who described themselves as being of Black, Asian or mixed ethnicity, were approximately 30% less likely to know about that cancer risk or to recognise it compared to those who described themselves as white Irish. Of interest, those who were eating more than their 5 a day of fruit and vegetables were 23% more likely to be aware of that risk compared to those who were not. So what recommendations can we make from this? Overall, unprompted awareness is very low at just 25%, or 1 in 4 Irish adults. And really, I would recommend that we should consider universal campaigns to target this. But in addition to that, prompted awareness is particularly low in certain socio-demographic groups, and they would benefit from more targeted interventions. So those early school leavers that I mentioned, those from ethnic minorities, and those who described themselves as students and the unemployed. But do awareness campaigns work? And how would we approach awareness campaigns? So to try to get some insight into this, I just circle back now to that literature review that I mentioned at the beginning. And just from the papers that had come up in the initial literature review, I just pulled out some information about awareness campaigns that were implemented elsewhere and whether or not they worked. So firstly, there was an awareness campaign run in the UK in 2018, which was quite controversial. It was run by Cancer Research UK. And you can see there were 6 elements to that campaign. There was a poster, a radio advert, there were 2 Facebook ads and 2 video clips. And they had a very stark message that obesity is a cause of cancer. And these images you can see here are taken directly from that campaign. So the response to that campaign was analysed by Usher Smith in 2023. They evaluated the reach and the impact of the campaign and assessed the impact both among members of the public and members of Parliament. They surveyed people pre-campaign, immediately post-campaign and 2 months post-campaign. And they found that pre-campaign, just 17% of people had awareness of that obesity-cancer link. Immediately post-campaign, that had raised to 43% awareness. And 2 months post-campaign, it was sustained among the public at 30% of awareness. 75% of respondents said that they found the campaign believable, informative, an important source of messaging and responsible advertising. But 64% found it worrying and 8% found it offensive. 30% considered changing their eating behaviour and 20% considered changing their activity level. And interestingly and importantly, there were no persistent increases in negative attitudes towards people living with overweight or obesity after the campaign. And what of the policymakers, the members of Parliament? 23% of them had awareness of overweight obesity pre-campaign, which increased to 37% post-campaign. 71% agreed it was equally important to tackle obesity as smoking. 95% thought it had an important message, but only a third had discussed this campaign with their constituents and 44% intended to do so. Moving on to another paper in terms of looking at social marketing campaigns. And in this paper, Kippen described that there was a role for both audience segmentation and whole-of-population approaches in cancer prevention social marketing campaigns. So this paper suggested that targeted campaigns should be aimed at groups with particularly low levels of knowledge, like the ethnic minority groups that I mentioned earlier. But still, traditional population campaigns should also be implemented to enhance awareness overall of overweight and obesity as a cancer risk factor. TAPA performed a sort of a quasi-experimental intervention. They reported on one that was performed, I should say, in a rural United States community. And in this community, there was very low average awareness overall that overweight and obesity was a risk factor for cancer before the campaign. It was just 35%. And the campaign, the group was divided into 2. Half of them received one-to-one advice and educational materials. The other half got this information, but they also benefited from placards reinforcing that messaging in their local shop. And in both groups, knowledge about overweight and obesity as a cancer risk factor increased after the campaign. 13% though in the intervention community, those who had the placards, compared to just 8% in the control community. So this showed the effectiveness of a multifaceted community-based approach to awareness raising. And then finally, I'm going to leave the last word here with some patients or participants. And this was a paper that was reported by Nicol et al. In 2023 and reported on an Australian study where 51 Australian women were asked about their knowledge about the link between breast cancer in particular and cancer risk factors. And they reported overwhelmingly that they believed they should be given this information on modifiable risk factors and it should be communicated more widely. They expressed a strong preference to get a cascade of information, so where they'd maybe be given a little bit of information and presented with links then to click into further detail. And their preferred method of communication was social media. So one woman said, "I'm quite shocked about the weight thing and that I haven't had that information, even though I'm really well informed about most things." Another woman said that, "I've never heard of weight in relation to the chances of developing breast cancer." So in terms of the key takeaway messages from today, only 1 in 4 Irish people think of overweight or obesity when they're asked about risk factors for cancer. So universal awareness raising needs to be implemented, but certain socio-demographic groups are at even higher risk. Those who have lower levels of education, those who are from ethnic minority groups, and those who are unemployed would benefit from further targeted interventions. And messaging does need to be considered carefully. But overall, from this limited amount of data from these papers that I've spoken about today, the preference of the public in other countries appears to be that they would prefer to be informed. And thank you.